Welcome back to Nclex review class. Today I'm going to be teaching on diabetes mellitus. Its types such as type 1 diabetes, type 2 diabetes, gestational diabetes, hyperglycemia, hypoglycemia, its treatment and nursing management. Come on guys, let's get into it. And please, if you're new to my channel, you're welcome. Please do not forget to like, share and subscribe. If you subscribe, you'll be able to see my other videos when I upload them. Okay guys, let's get into it. Insulin. What is the function of insulin? Insulin breaks down the blood glucose level, converting it to energy. First of all, insulin is being produced by the pancreas. So when there is inadequate insulin production by the pancreas, what happens is going to lead to hyperglycemia. And the hypoglycemia occurs when the blood glucose level drops rapidly, either by excessive production of insulin breaking down blood glucose level leading to hypoglycemia, or rapidly when you take excess hypoglycemic agents that could also lead to hypoglycemia. Actually, hyperglycemia is just high blood glucose level in the blood, and hypoglycemia, as the name goes, hypo, it is hypoglycemia is low blood glucose level in the blood. Now we have type 1 diabetes and type 2 diabetes. Type 1 diabetes is also known as insulin dependent diabetes. It is the form of diabetes that is genetics and is being seen through childhood. Its management is also, like I said, insulin. While in type 2 diabetes is lifestyle form of diabetes. It is a form of diabetes that is being managed through diet, exercise, and hypoglycemic agent. Like I said, since it's lifestyle type 2 diabetes, then its management is also going to be lifestyle, exercise, diet, and medications. But in severe cases, insulin can be used. Okay guys, now let's go. I'm going to break down diet, exercise, and hypoglycemic agents. Now, diet. What kind of diet do you give to a patient, on a diabetic patient? You're going to give your low carbs diet. So, and also diets with low sugar. Now, we say exercise. What does the exercise do to the body, especially a diabetic patient? Exercise lowers cholesterol. Exercise lowers blood glucose level. And exercise also decreases insulin resistance. When do you exercise? When do you advise your patient with diabetes to exercise? Advise them to exercise same time, especially at the peak of the meal, not when the insulin or medication. Glycemia. The number one cause of hyperglycemia is being triggered by illness, by stress and infections. And please, when patient is being triggered, is having illness, infections, at this point patient needs insulin, or the patient is going to go into hyperglycemic crisis or diabetic ketoacidosis. Now, hypoglycemia. What is hypoglycemia? Like I said earlier, hypoglycemia is low blood sugar in the blood. Hypo, low. What are the signs and symptoms of hypoglycemia? How do you know that this patient is going into hypoglycemic crisis? When you see that patient, the patient is shaky, nervous, palpitation, tachycardia, drowsiness, weakness, double vision, lightheadedness. I remember when I was preparing for Nclex, actually those days in nursing school, we used to remember it. I am shaky, palpitation, tachy, like almost everything is increased. Patient is tachycardia, increased heart rate, palpitation, I am shaky, tachy, pappy. Maybe you should remember this in your exam hall if you come across the questions. Shaky, pappy, tachy. Okay guys, so your symptoms, your assessment on a patient with hypoglycemia is palpitation, tachycardia, shakiness, nervousness, drowsiness, lightheadedness. Okay, what is your treatment? Even sweaty, yes, sweaty. Now, what is your treatment on a patient with hypoglycemia? The first treatment, the number one treatment on a patient with hypoglycemia is your simple carbs. Candy bar. I know you guys know this. Candy bar. Nclex love this question a lot. Candy bar. Just give your candy bar, give your crackers and orange juice, half tablespoon of honey or syrup, and half cup of fruit juice. This is your management for a patient with hypoglycemia when the blood glucose level is low. What is the normal blood glucose level? Currently is 70 to 110. Okay guys, your lab values are very important. One of my classes, I know I'm going to be treating on lab values too, so that you guys will also catch up with that. And please, lab values are important if you're preparing for Nclex. Now, a patient with hypoglycemia, if the patient is unconscious, are you still going to give anything through the mouth? No. Why? To prevent aspiration. Please note, do not give any fluid or food through the mouth on a patient that is unconscious, even semi-unconscious. The answer you're going to pick in case you come across such question in Nclex is, if a patient is unconscious, please, if he's at the hospital, IV D50 dextrose water is given. But if he's home or any other place, glucagon could be given, either by subcut or by IM. Okay guys, thank you for watching. I don't want to get you bored with a long diabetes mellitus is really a lot, so I'm going to be doing a part 2 of this section where I'm going to be treating on insulin and other nursing management. Okay, thank you guys for watching. I appreciate you all. Please, diabetes mellitus is really important. You're gonna see a lot of questions on diabetes mellitus, especially on insulin and signs and symptoms. The 3 P's, your polyuria, your polydipsia, and your polyphagia, which you see in type 1 diabetes, is really important to know. And also your management of patients with hypoglycemic your simple carbs, your candy bar, your fruit orange juice, half tablespoon of honey. Please, this is very important. And please do not give anything through the mouth to a patient who is unconscious or semi-unconscious to prevent aspiration. Always choose your D50 in a hospital scenario, and when at home or any other place, your glucagon IM or subcutaneous could be given to the patient. This Nclex like these questions a lot. And please, your signs and symptoms of hypoglycemia is very important. I see it on most Nclex questions, and a lot of people who have taken the exam will always tell you, oh, it came out for me. Actually, I haven't seen who wrote Nclex without getting question on hypoglycemia. So please guys, note this. It's very, very important. Okay, thank you guys for watching. If you're new to my channel, you're welcome. Please do not forget to like, share, and subscribe, and I will appreciate your comments. Thank you guys. Bye.